I'm an open book. This is what my vlog and my blog was created for. I'm here to inspire, uplift, and just promote and embody natural and real womanhood, motherhood, everything. Opposed to what we see nowadays on the internet. A lot of people don't talk about these things. A lot of people shame it and think that it shouldn't be shared. For me, I don't care. I cross all boundaries. I cross all lines. So first is what happens to your body after childbirth. So every woman's different. Every pregnancy is different, as I've been saying. But pretty much after you give birth to your baby, depending on if you have an epidural or not, walking around and getting around, it's gonna feel a little bit like you're drunk, just because you have, you know, sailor legs or whatever they want to call that. Your belly is immediately, it feels like jello, I would say, just because you've had a baby in there and you're used to such a hard stomach that everything feels wiggly and jiggly. You feel a little bit lighter, and your body overall, like, you just feel kind of tipsy, like a champagne kind of drunk. That's how I describe it. Depending on how many children you have, I felt like the second child, I was up walking around more, and now third child, I'm literally, yesterday I was 10 days postpartum and I was working out. So your body definitely knows what it went through. Are your boobs different? So 100% as well. Your entire body is never gonna be yours again as you've known it for the past however many years. So first pregnancy, I didn't get my milk in until I got home. When I came home, I had like triple D's. No one could touch me. My arm could not touch the side of my chest. Your chest is burning hot from all the milk coming in. I wasn't planning on breastfeeding with my firstborn because she was so big, and my boobs were so tender that once she just wasn't latching at the hospital, I was like, okay, it's not for me. I'm not doing it. I'm all for just feeding your baby. I'm not anti-breastfeeding. I'm not anti-formula. I believe that however your child is fed does not matter unless you're feeding your child, like 100%. I was also working full time, so breastfeeding for me with my first two was just never in the cards for me because of the whole pumping and then leaving the breast milk to whoever's taking care of your child and all of that. It wasn't for me via my lifestyle. So what I did with Avon after my milk came in was I was so engorged that my midwife told me to put cabbage leaves on my boobs, and it leaked all the milk out, and then that's it. I'm assuming it's like the same thing if you were to breastfeed for say a year and then your ducts drain all that milk out. You're left with like a little bit more skin on your boobs. You may get stretch marks on your boobs. Your boobs for sure get bigger if you're choosing to breastfeed. You have milk boobs the entire time you decide to breastfeed that are big with the veins. So I would say after even one pregnancy, two pregnancies, and now going on to my third, you definitely lose a lot of that like good oomph of your boobs. Your boobs might drop a little bit more. Mine haven't ever really dropped necessarily just because I never breastfed. So even though my chest did get engorged, it didn't make my boobs shrivel up as much because I mean, it's not like I was filling them, losing them, filling them, losing them, if that makes sense. But for sure, my boobs have changed. Your areola around your nipple will grow when you're pregnant. Your nipple color will change while you're pregnant. You'll get very veiny boobs. So yes, your boobs will change, and you will have amazing, big, huge boobs during your pregnancy, and then after the baby is here, your boobs tend to drain down. With my first two babes, I'm sure it will happen this time as well. I lost a lot of the fat content in my chest so I could like feel my bones underneath, and I was super self-conscious about that. Do my hips feel different? So I was skin and bones before I got pregnant with my first daughter. I believe I was like 112 pounds. I could never even reach 120. I used to eat boxes of Twinkies. I used to eat like shit. And I got hips from Avon, my firstborn. Your hips widen when you're pregnant. You get into your womanly body, and my hips 100% have gotten wider and wider with each pregnancy, which I don't mind it because I'm here for that nice hunky woman's body. So vagina, how does it feel and how do you take care of yourself? Okay, so like I said, these, for me, I feel like I could talk about this for hours because I've had 3 different children with 3 different experiences. But starting out, actually from the first to the third child, it was like worse to better, or worse to better to best. So when I gave birth to Avon, I needed 6 stitches, depending on how much you tear. I gave birth to a huge baby, so I did tear with Avon. I got 6 stitches, and it was a crime scene. You go to the shower, you take your first shower, you come out of the hospital bed, and immediately you're just dropping blood, and you're holding a pad between your legs like a big pee-pee mat, like a dog mat. You're holding it between your legs, and you're going in and you're peeing and making sure you pee after labor, and then you can choose to take a shower and do all that. There was the mistake of the hospital. On the door of the bathroom was a mirror. So I will never forget this image of me. I was sitting down, like I didn't want any nurses to help me. James had the baby, and I was sitting down, you know, getting myself adjusted, and I look up and I just see the biggest swollen vagina I've ever seen in my life. It's so swollen, so terrible, and not to scare anybody, but I was literally going from 112 pounds to 136 pounds, I believe. It was a few hours after I pushed her out, and I was swollen, and I never felt anything like that before. When you're at the hospital, I had never heard about any of these things, and I got introduced to them. There are four things that will save your life. Number one was a padsicle. If you're super swollen after you give birth, it's basically a long, huge maxi pad, and you break it like an ice pack, and the top part of it is taped down onto the regular maxi pad that's like a super extra long one, and it has ice in it, so it's a padsicle, like an icicle pad. And for my firstborn, I loved it because like I said, I was super swollen. It took the swelling down, and it with my stitches and everything like that, like it just felt amazing. You lay one of those down, there's some cream, it's like a hemorrhoid cream, because let's not forget, ladies, you're pushing. So you're pushing so much, and especially like with Ave and Jade, my first labor experience, my epidural was like, it was perfect. So I couldn't feel anything. So you don't even know what pushing feels like if you're overdoing your epidural, which I was, because I was scared as shit. I was 21 years old, and I was my biggest fear in life since I was a kid was giving birth. It was like clowns, dying, and giving birth. It was terrible. Hemorrhoid cream, because I got hemorrhoids. I had 6 stitches, I had a swollen vagina, and I was gushing blood. So no one's gonna tell you these sort of things. They tell you how bad labor is, but they don't tell you the postpartum. Aside from the padsicle and the hemorrhoid cream, there are these Tux pads called witch hazel pads, and you line them all up. It also has the same ingredients that a hemorrhoid cream would. It has a cooling effect, so it feels good. It shrinks your hemorrhoids. It feels amazing. It feels great on your stitches. And then there's a spray as well, so you can spray, and it kind of numbs and cools everything depending on how severe. If you tear, if you just feel swollen. A lot of people who don't tear suffer with like the whole butt, like the butthole scenario, which is when you have bad hemorrhoids, or you tear a little bit of your butt from pushing, like your actual butthole, guys, like you tear that, or your skin around it gets raw because it's so stretched out. It's real. This is what happens. You think that a head that's this big is just gonna slide out of your vagina. Your vagina is a muscle, and it will go back, so don't worry. But yeah, these are the realities. So also, you're gonna go into your hospital room, and you're gonna find a squirt bottle, and you're gonna fill it with warm water every time you pee, because you don't wanna use toilet paper. Toilet paper is gonna stick to everything, especially because you're bleeding. You are just gonna take warm water, and you're gonna squirt yourself, and that is how you're gonna wipe yourself, potentially for as long until you feel healed. Daddy's interrupting our video. Your team is. All of these items in your bathroom are gonna be your best friend. With my second born and this third baby here, I hated the padsicles. With Ivory, I only needed 2 stitches, and it's because I wasn't listening when she told me to stop pushing, because as I said previously in this video, I could feel everything, and it just wasn't pleasant for me. So I was like, yeah, right, I'm not gonna ever stop pushing right now. I want this baby out of me. And so I did get 2 stitches with Ivory, and with Oakland, she was my little sweetheart, and she didn't tear mommy. I did get hemorrhoids, TMI, whatever, but my vagina after Ivory, it wasn't as swollen. I was walking within 2 hours. I wasn't using a padsicle. I was still using a long maxi pad. I was still using the witch hazel pads and the cream because it felt amazing, and obviously hemorrhoids, #hemorrhoids. Everyone gets hemorrhoids. With Oakland, I still have the squeezy thing in there, but I did start using toilet paper again. My vagina is not swollen. It did not swell as much. I felt like at the end of your pregnancy, when the baby drops down and the baby's, you know, head down, you get a swollen vagina. And so of course after labor, like your swelling goes down and everything. I'm 11 days postpartum today. It feels like normal. The key is Kegels. Everyone says this all the time, but seriously, have to strengthen those muscles again. They're not just gonna strengthen themselves. Second time around, second born, of course you get the peeing, the sneezing and laughing pees, where you're sneezing or you're laughing, you're gonna pee a little bit. It's because your bladder is weak and your vagina's been through the ringer, and you gotta work on it. You gotta do your Kegels. My midwife tells me to do 50 a day. I'm doing them right now as we speak. Like Kegels, Kegels, Kegels. But yeah, all vagina talks. Vagina, vagina, vagina. Am I making you feel uncomfortable yet? Did you have a natural labor? I still don't walk around saying I had a natural labor because I opted for the epidural, but my midwife is just playing games. It was looking at the anesthesiologist like, slow down, like go slow. Like she didn't want me to get it, but what helped me was, even though I felt like I had the baby without the epidural being in me and working yet, as soon as the baby was out and the epidural drip started into my back, it put me at ease. It not only numbs you from the waist down, but it transitions your body so it makes you feel relaxed. And because I had such a traumatic labor and I was very, very, very nervous and I was almost in like a panic mode, the epidural did help chill me out a little bit for like the 10 or 15 minutes that she let it stay in my back, and then she had to sit me forward to pull it out. So I don't consider it natural, although all the nurses say that I gave birth naturally, and my midwife says I gave birth naturally, and my family is telling me like, holy shit, you're a beast. But because I opted for the epidural, and I got Pitocin, I don't think that those are natural things, because your body, I didn't go into labor naturally or anything like that, so I don't consider it a natural labor. Did I prep for birth with any videos or classes? I actually didn't. I have a midwife, so I'm the type of annoying patient who's going in every week with questions and questions and questions. I really just didn't take the time to do any classes. I feel that there's a lot of resources on the internet now, except if you're a first-time mom, never watch labors on YouTube. That's what I did for my first two, and it was terrible. Never do it. Even just don't watch Knocked Up. Never watch Knocked Up. You're gonna cry, you're gonna be an emotional wreck, but you're also gonna shit your pants because it's so scary. And like I said, I've always been scared to give birth. Like, it's been one of my biggest fears since I was a child. I really, really, really knew I was born to be a mom, and I loved kids, and I wanted babies. I always wanted to be a mom, but I was brutally, I'm nowhere near motherhood or anything, but your video was my first time seeing a birth. I didn't expect that you were kind of on your side, or your legs were on your side. I guess I always thought you'd be spread eagle in the stirrups, like you have to do that at the OBGYN. Also, I had the sexy undies and pad. Pretty neat, you're willing to share. Congrats on your miracle. So cute. Love this message. So the reason why my legs were on my side were two reasons. Number one, when I was giving birth, I was feeling everything. So for some reason, having my legs closer to me and not spread eagle, like spread eagle probably would have been easier for me to hurry up and push the baby out, but my entire body was so clenched up because I've never experienced something like that before at all. Like, the pain of ivory was nothing in comparison to what I went through, and I'm not trying to scare anybody because, like I said, I just waited too last minute for the epidural and I was just in panic mode. So I think that leg was kind of like still stuck in that position, because when I was sitting up to get prepped for the epidural, my leg was right where that leg was in the video. It was right over, like hanging over the side of the bed, because you have to push yourself to the side of the bed and keep your legs dangling. Now, from the moment that he taped the thing on my back and they helped me lay down, I was already pushing the baby out, so my leg kind of didn't have a chance to move where I wanted it to. Also, usually James is holding that leg on the left-hand side, because usually your partner holds one leg and like a nurse is holding another leg. That's how I gave birth to my other children. But James was delivering the baby, so he wasn't actually holding the leg this time. And then third of all, I also knew that I was being recorded from that angle, so I didn't want the camera to see too much because I didn't want to freak anybody out. Sexy undies comment is so funny. I call them sexy undies because they're in no way, shape, or form sexy. They don't make you feel sexy, but they do hold you in. These are hospital underwear. These are the ones that they give you at the hospital, that the hospital gets a huge you know, batch of them in for women. They're one size fits all. They're stretchy undies. They're very, very cheap. especially because you're constantly sticking a pad to them. Every time you rip the pad off, you're kind of breaking the seam, and then there's like string everywhere and it's a hot mess. And then the pad, you're gonna wear a pad for the first, at least, if it's your first baby, like for the first at least month, you're gonna be wearing a huge pad just because of all of the blood. And then you're gonna like wait and then get your actual period again. So you're gonna be in like a long overnight maxi pad. I don't know if this is something you're comfortable talking about, but sex after birth. No touchy for me until I'm on a contraceptive. And then when you're on a contraceptive, you want to be careful because it takes about 3 months for birth control to even regulate in your system. So condoms. Sex after birth is very similar to sex during pregnancy. So your sex drive is different. People that are pregnant, their sex drive either increases like crazy and you're a rabbit, or you're like, don't effing touch me, get away from me. Number two, it's a self-conscious issue. It's, how do I look right now? Everything's jiggling. Look at my chins. I want to wear a t-shirt. I don't want to be seen naked. Don't touch my boobs. They're hurting. There's so many different details in terms of sex pregnancy and then sex postpartum. Of course, it was my first time I had a baby. I was questioning my boyfriend at the time. Does it feel the same? Does it feel the same? Like, I was so self-conscious because you don't know if they're just gonna say yes so your feelings aren't hurt, or you don't know if your freaking Kegels have been working. So yes, you wanna ask your partner because you feel insecure and they reassure you that no, it feels the same. It literally feels the same, which is awesome and it's amazing to hear and it's great. Overall, I feel like for sure after my firstborn, my sex drive plummeted. I had such a big baby, struggled very, very badly with postpartum depression and body positivity and everything. That is why I started this blog, because of 21-year-old Kasha, a lost soul, and I got into modeling and I tried to do things to make myself feel better. Am I still attractive? Am I gonna get my body back? I need to work out. Oh my God, what should I do? I need to go back to work. I need to make money. I need to help him. So it was so different. So that could definitely affect the sex for sure. But in terms of like, does sex feel good, or is your vagina this deep hole of nothingness? It's a muscle, and it's gonna be back remotely somewhat to normal. I would just say the difference for me has always been bladder. Like, I'm gonna sneeze and I'm gonna pee sometimes, or I'm gonna, you know, laugh and pee sometimes, or something like that. And that's something that all moms struggle with, and it's just funny. And I say it to James all the time, like, stop making me laugh, you're gonna make me pee. And it's just, people need to get more comfortable with those little aspects of postpartum because it's real. Sex-wise, it could depend and vary on your self-confidence. But in terms of like drive in general, that's completely up to your hormones. Your hormones change drastically after you give birth. So you could wanna hump like a rabbit all day, I don't know, or you could, like I said, just be like, don't come near me, I'm not interested in sex, I'm interested in the baby. And obviously after you have a baby and then you have multiple children, it's like, where do you find time to have sex? And this is what I say, you don't, because if you keep having sex, you keep having more babies. I'm just kidding. Are you nursing or formula feeding? I am formula feeding. If I missed any of you guys' questions, you guys can always reach out to me at any time. There were a lot of questions, but more than anything, there were so many positive comments, and I just wanted to do a little, you know, message in here, because when I was going into labor and when I was posting for all of you guys to send me your prayers and your positive thoughts and messages, I'm not kidding, that really did help me. I got to sit in the hospital bed and, you know, read all of you guys' messages, and even if I never reached out personally to each of you, they really did help. I was sitting there looking at James, just tearing up at how much support. And it's so amazing because social media can be misconstrued in so many different ways for people that look for attention, and, you know, Instagram models and everything that's very negated. And for me, I obviously use this platform to spread positivity and love and light, and it's been working lately, and I've been receiving so many beautiful messages from women everywhere, and they don't even have to be moms, just inspiring you guys to embrace your natural and just to be you, and just to whatever. You guys have been reaching out and thanking me for that, so I just wanted to give thanks back. This has been absolutely amazing. I've had my blog for about 3 years now, and I've only been taking it seriously for the past 2, and the amount of growth and the amount of community that I've created on here is freaking incredible. With that being said, I'm here for all of you guys. I will try my best to check my messages. I try to check it in the morning, midday, and night, just to see if I have any new message requests, so that I don't miss out on you guys' questions. You guys can always comment below here as well if I don't answer your DM. Blow me up, whatever you guys need to do. They're really, really, really great questions. For all the moms that have already been giving birth and I didn't get to answer you in time, congratulations. And like I said, these videos aren't just made for moms. My content has been directed towards a lot of moms lately, but just know that I'm still here. I'm a woman first before I'm a mom, and that's the most important thing. I'll give you one more look at our little Oakland Zen. Beautiful. Bye.